Welcome to another edition of the Watchful Citizen. Today our guest is Bowen. Aaron, welcome to the Watchful Citizen.
Thank you for having me.
Please tell us who you are and why are you here today?
Okay, I am Deputy Director at Community Action Partnership of Lancaster and Saunders counties. So we're one of 9 community action agencies in the state of Nebraska. And we've been in Lincoln. We used to be Lincoln Action Program, but then aligned with the National Community Action brand about 6 years ago. But we've been here 50 years now in Lincoln. I think we were incorporated in 67, so we're almost there as an agency at 50 years, but we've been around for quite some time.
Great. Tell us a little bit more about the history of the program.
Well, community action kind of sprang from Lyndon Johnson's War on Poverty, which was headed up by Sergeant Shriver. So at the same time, community action as a nationwide network, we cover about 96% of the counties nationwide, including some of the U.S. territories and Puerto Rico. We have agencies there. So in Nebraska, there's 9 agencies, and our 9 agencies cover every county in Nebraska. So like I said, our agency here in Lincoln, we serve 2 counties, Lancaster and Saunders counties, and we've been incorporated since I think 1967. And so we started with, again, when community action began, federal money went directly to communities to fight poverty at a local level. And so Sergeant Shriver headed that up, and then in 65, Head Start began, and we've also been grantee of early Head Start and Head Start dollars for some time. Head Start for about almost 50 years this year, and then early Head Start started in the early 90s, and that federal money comes through our agency as well.
So this is really a product of President Johnson's War on Poverty from back in the 60s, and it's still going and viable today. What populations are served in Lancaster County and Saunders County?
Well, nationwide, there are about 35 million people living in poverty. Community action agencies tend to serve those at really low income. So we're talking about 75 to 100% of the federal poverty line. So for a family of 3, that's under $10,000. So in Lincoln and Lancaster and Saunders counties, we serve basically that same population. So we're looking at a lot of families that are 100% of the federal poverty line or lower. So families, a lot of times single parent headed households. We serve a lot of families with children, but we serve, again, those families that are really struggling with poverty and the effects of poverty.
Can you describe some of the services that you provide to these populations?
You know, community action over time has really, our goal is to adapt to the needs of the community. So I think there was a time when a lot of agencies, including ours, used to do a lot more basic needs services. So food distribution, emergency services, that was a lot of that. Over time, Lincoln has a lot of great not-for-profit agencies, and a lot of them are very generous. So we've kind of carved our niche in the area of economic stability and economic security. So our goal when folks come to us is that when they leave us, because we don't have the funding to serve them for their lifetime, and so when they leave us, we want them to be more economically secure than when they first came to us. The idea of self-sufficiency, of course, is a goal for everyone, but that's a tall order for families who start at such a low-income level and without resources, without skills, without education. And so our priority is when they come to us that we offer enough services that they can stay with us, whether they come in for deposit assistance or they need help with an eviction or they're trying to find access to great child development for their children. We can start them, and then hopefully all of our programs channel them to greater economic stability and hopefully self-reliance, because we want them to be able to utilize their own strengths and resources and to take care of themselves.
So someone comes to you and they have some problems, so some short-term problems that you help them through so that they can go on and be more economically stable. Elaborate on that a little bit. Are you saying that the organization provides some type of job skill training, or how does that all work?
Sure. So if someone were to call our emergency services department, we provide probably the most emergency services in the community. We have a partnership with Lincoln Electric System. We also get funding from the state and the federal government to provide rent, utility, deposit assistance for families who may have, it's not unusual to see families with $2,000 in arrears with an electric bill or a gas bill. They're going to come to us if they qualify for that service. We're going to try to figure out why they're in this predicament in the first place. We don't want folks to leave us and come back 6 months later and ask for the same assistance. So we're going to try to ask those questions to say, what got you there? What resources do you have? Are you working? And if families want case management, we're going to provide that to see if we can get them closer to a place where they can prevent crisis themselves. some families aren't ready for the services we're willing to offer because we ask them to commit something to the process. We believe they've got the strengths to do this for themselves. And so if we feel like, yeah, you're making strides, you can do this, we might put them into the economic stability program where we can work on, we want folks to get a degree, we want them to get banked, we want them to have savings, because those are definitive steps toward economic security. If you don't have a degree, it's going to be really hard to make anywhere near a living wage for our community. And really for our community, I think a family with one parent and one child is $17 an hour. If you're unskilled, you're not going to make that wage most anywhere in the community. So our goal is to, if they're ready and they have the skills and we've got the staff and the resources available to support them, that we can march with them as they get closer to a better place so they can provide for their family even more.
So how do you find each other? How does your the community find you, and how do you reach out to them?
Sure. Well, word of mouth is the best way, and of course, Lincoln Action Program. We've been around. A lot of people know of LAP or Lincoln Action Program, but I think in the past 6 years, we built a reputation as an agency that, if folks are willing to commit to us, we can provide them with the services that get them closer to economic security. So, if someone gets help with an electric bill and they get great services from us, that word travels fast in the community, and we pride ourselves on really building a strengths-based relationship with our clientele. So it's not a handout. We're really working alongside them, and we believe that they can drive the process. We're just there as an added support.
So do you know roughly how many people you serve in a given, what is it, like a year, or how do you measure that?
Yep, we go year to year, and generally it's between, I would say 13 to 15,000 people every year annually that we serve. So that's every
Lancaster and Saunders combined.
Yep, and so of course Saunders County is a different area. It's primarily rural. Our services really kind of come out of, we have part of our Head Start program is within Wahoo Public Schools. So we have classrooms there, and then we have one staff person who works inside Wahoo Public Schools, but she also does the volunteer income tax assistance, she does the health insurance navigator, she does emergency services, she does it all. And so our goal over the next few years is to expand more of our services and see what more we can do in Saunders County and outlying Lancaster County, because of course most of the poverty in our two-county service area exists right here in Lincoln.
Since the economic crash of 08-09, did you see an increase in people needing services from your organization, or has it kind of stayed fairly stable over the years?
I think it goes year to year. I think we always have people struggling no matter what may be happening at a national level. I don't think we saw some of the spikes that other organizations may have seen with families needing more access to food, because a lot of our families may not be working. I think their struggles exist no matter what, even despite what may happen with the banking system. A lot of our families already been banked, and so they're not going to feel that, but what they do feel day to day is just what it means to be hungry, to be worried about what we kind of sometimes talk about, the tyranny of crisis, of this kind of revolving cycle of always not quite having enough and not knowing how to figure out how next month or the next day can be better. And so our goal is to get them, hopefully they find us or we find them, and we can start to help them see that there's a better future no matter what their resources. They've got things they can do and steps they can take to make it better the next time around.
Talk a little bit more about the funding resources that you rely on to run your programs.
Mm-hmm.
Is there any local revenues raised, or is it all strictly federal government?
No, we used to be really primarily federally funded. That percentage has gone down. Of course, our largest program is Early Head Start and Head Start, and that's direct federal funding that comes to our agency. We have a large HUD supportive housing program, but there also is a number of funders locally. United Way is the first one that comes to mind that really supports what we do. The Woods Foundation has supported what we do, the Able Foundation. So our goal is to diversify our funding as much as possible, and then of course fundraise as much as we can within the guidelines of federal funding. And really our goal is to help the community see the variety of programs and services we offer, and hopefully something piques their interest and they'd like to give of their time or of their resources to the agency.
So Aaron, what do you primarily do in the organization? What is a typical day for you?
Sure, I have a number of titles. So I work closely with Vicey, our executive director. Right now my titles are Deputy Director. I've also been Director of Early Head Start and Head Start for the past few years. And then currently I'm also Director of Educare of Lincoln. So Educare is probably our newest partnership, and we partner with Lincoln Public Schools, the UNL Foundation, and the Buffalo Early Childhood Fund to have an Educare here in Lincoln. So we're connected to Belmont School, and within that school we serve 158 children who are 150 of those who are early Head Start and Head Start children. So our funding supports those children. So that's our part in the partnership, and we're one of 20 educators nationwide. So we're very, very lucky to have one. And so my goal is they're in a transition phase. I've been over there. So interim is part of my title a lot of the time. But generally, I think my biggest responsibilities are to make sure that we're meeting the demands of our community and overseeing overall how the programming looks. I fixed a lot of programs, but at the same time working with staff, because we've got one of our strengths as an agency is we're a really great place to work. We've got a lot of great staff who are committed to making home visits, to taking calls each and every day to make sure that folks are welcome and get the services they need.
So it sounds like you described a little bit about the vision and the mission of your organization. Can you be more specific about what is the mission?
Our mission currently, and we're in a strategic plan right now, so it's subject to change, but our mission right now is to empower people struggling in poverty to reach their full potential and achieve self-reliance. So our goal, again, is it's about empowerment. It's about taking a strengths-based approach. So if someone comes to us and asks for help, we're not going to look at them as needy or you need us to survive or to make a better day for yourself. We believe no matter who comes to us in whatever circumstances, they've got strengths and they've got resources to do a lot of the work for themselves. The example we use a lot of times is a refugee family that we start working with, and they may need the help of a home visitor to read their mail. Well, what we want to do immediately is we think they can try to read their own mail, and those little steps and celebrating those are what's most important, because if people start to feel the confidence that they can do these things, they don't need to rely on agencies like ours, because in the end, there are a lot of not-for-profit agencies in town, but the demand and the need is still greater than any of the resources that we might have collectively.
So it sounds like a holistic approach to providing support to families so that they can become independent. One of the things that you mentioned earlier was a navigator for the health program for the ACA. Tell us a little bit about how that works.
Sure. Well, within the network of services we have, we know the cost of health care for our families and the lack of preventative care. So in our Head Start program, for example, we really have to prioritize making sure that children get their well child checks, that they receive preventative care, and if they need treatment, they get that treatment. Well, the same goes for the adults that we serve. We know the massive debts that our folks incur. We know there's overuse of the emergency room. Don't have a medical home, and so the ACA really came in. It began last year with the health insurance marketplace to give folks the opportunity to get health insurance sometimes for the first time, or to get affordable health insurance for the first time. And so with a federal grant that came to Community Action in Nebraska, which is the state association that does some statewide initiatives and works with all of our 9 agencies, with a federal grant that came through them, we had the ability to hire and train health insurance navigators, and then we've also trained certified application counselors to provide help with the marketplace. Last year, of course, the big challenge was it was year 1, and the technical difficulties of that were widely known. And this year, of course, the concern with co-opportunity, which we're moving through, but we've seen, I think nationwide, 87% of the people who have enrolled through the marketplace have received some type of tax credit or cost-sharing plan. So the plans have been really low. We've seen young people get premiums as low as $25 a month. We've seen folks with chronic health conditions come in and realize they get a low enough deductible that they can meet it within 1 month and still get the care that they need. So it's been pretty remarkable to see, because health and preventative health is a way to, again, if you're talking about economic security and independence, folks have to take care of themselves. They need the means to connect with a doctor and to have insurance to cover those circumstances, because for our families, one broken leg that costs you $10,000 in a hospital it really sets you back years.
Our state last year decided not to participate in the Medicaid expansion. Does that impact the populations that you serve, or how do you feel about that?
It does. A lot of the people that we serve, of course, are Medicaid eligible. But again, Medicaid as it currently stands in Nebraska is limited. So what Medicaid expansion would have done, it would have brought, number one, federal dollars to the state, but it also would have expanded the eligibility for Medicaid. So folks who don't make enough to qualify for tax credits and cost sharing through the marketplace would still qualify for Medicaid. While it's not expanded, then we have a gap. And so someone comes in and says, I make a little too much to qualify for Medicaid, or I don't qualify for that service, but I don't make enough for tax credits. So you're lost in limbo, and we've had to tell people, you don't have much option here. The only option you have is to call your state senator and to make, to make sure that's known we need to expand Medicaid in Nebraska so folks have access to that needed service. Because what's happening if we don't, we still have that overuse of the emergency room. We have people that are not getting treatment for certain things, and we all end up paying for that. And most importantly, those families suffer needlessly when we have the opportunity right now to expand it.
Our state representatives are going to be introducing bills to reintroduce the Medicaid expansion. Does your organization work in any way with the state legislators? Is there a lobbyist arm of your organization? Could you talk about that a little bit?
It's a good question. Well, luckily we have Community Action Nebraska, the state association, which we've tried to work with, work with organizations like Nebraska Appleseed to come up with families who can testify and give examples of how they've fallen into that gap. Of course, since we're primarily federally funded, we can't also lobby with federal funds, and so it's that, we're in a spot where we've got things to say, and we definitely welcome the opportunity to talk with any senator about the plight of the families that we serve, but we just need to make it loud and clear. And then there are organizations nationwide, of course, Community Action has the National Community Action Foundation, which lobbies, but doesn't have the time and resources to do statewide issues. So the goal is, if we can partner with other agencies in the community, we can make that voice heard.
Give us an overview of all the services you've talked about some things, but you're doing a lot of different things. Could you kind of list some of the other things that you're doing for your communities?
Yeah, we have about 15 different programs and services. So if we start at the end of basic needs, at 14th and East Streets, we have the Gathering Place Soup Kitchen, which serves a hot meal, rain or shine, 5 days a week for anyone who would like that. And then we, of course, have our emergency services program that provides rent, utility, deposit assistance, et cetera. From there, we have HUD supportive housing, and we have transitional housing for families. So with HUD funding, we can help house about 55 families in units throughout the community. So we have a lot of great partnerships with landlords in the community that are willing to work with us. And then we also have tenant and landlord support services. So when we have those those conflicts around eviction and clients wondering, what can I do in this situation, we just make sure that they understand their ability under the law, the Nebraska law, to navigate that situation, to make sure that we don't have folks who are kicked out of their home, illegally, but also to make sure that they understand they have responsibilities as a tenant to make sure that landlord-tenant partnership works well. Of course, Early Head Start and Head Start is half of our agency's funding, so most of our staff are committed to getting kids birth through 5 years old, ready for school ultimately, but also that's a whole family approach to make sure that at the same time that their children are learning, those parents are getting support services, whether it's mental health services, to making sure that they can get a job, continue their education, because the goal there is, again, to break that generational cycle of poverty. So we want to make sure that folks don't need Early Head Start and Head Start down the road, but we provide home visitors through Early Head Start home-based. We have a partnership with both our delegates, Lincoln Public Schools and Wahoo Public Schools, so children are Head Start funded and Head Start children in classrooms around the community and in Wahoo Public Schools, and then also with our EduCare partnership. And then just a couple of our newest programs. Of course, we've always done weatherization, which is doing some home energy improvements for eligible clientele, but then of course moving to that economic security and stability. We have asset development programs, so we have individual development accounts where folks can save and they get their savings matched to make purchases of a home, a small business, to go back to school. And then also, of course, we've always done, we do some GED or education support. So folks come in and say, oh, I'm 2 classes away from that associate's degree. We want them to come and see us because we can take those steps with them. There's folks who are close to much greater economic security, but they need some support, that motivation to get past that. So yeah, we'll do job skills training. We have a computer lab where folks can come and study for classes or work with us on their typing skills or to create a resume. And one of our newest programs also is Opportunity Passport, which is folks who have either been through the foster care system and have aged out or are just aging out now. It's the same type of program as our individual development account program, but we want them to be able to save for, the purchase of a car for a young person means a whole difference in terms of transporting a child to and from daycare, to getting and keeping a job. And so that's one of our newest programs that's been really successful thus far. But I think it's hard to explain all of them, but the goal is, no matter where they come in, even if it's in a desperate situation to, I just need my rent paid, if we can do that at the same time, we're going to say, you have access to all these other services. We want to consider these to see if you can do more beyond just getting that one need met, because it's helping families think beyond the current crisis to know that you can take some steps to prevent this, and we're here to support you to that end.
I see that you also provide some homelessness prevention services. Sometimes in a community like Lincoln, where we are fairly affluent, they are the invisible members of our community. Lots of things can contribute to being homeless: a loss of job, medical services that are not there anymore, and drug abuse, that sort of thing, mental illness. How does your organization work with the homeless?
Well, we can't do it alone. We know that's a growing problem, but Lincoln's very lucky to have the Lincoln Homeless Coalition. And so there are a group of about, I would say, probably 20 to 25 core agencies in the Lincoln Homeless Coalition that do so much to make sure, Project Homeless Connect is one of those events that's been going on the past few years that we participate in. We don't have a shelter at Community Action. We don't take folks off the street and usually give them services. We don't house them. We don't feed them. But if we have someone who is homeless and we believe can qualify for our supportive housing program, we can hopefully get them enrolled and get them in a situation where they've got furniture and a warm place to stay. They can stay with us for a couple of years. For those, for folks who have substance abuse or mental health issues, of course we have agencies like Centerpoint, Region 5. So the goal is to partner, because there's no one agency in town that can take on the issue of homelessness in our community. And so, Lincoln Public Schools has a great liaison to families who may be experiencing homelessness and their children to make sure they're in school, they have the services they need. So that problem in and of itself is really a community issue that I was in part of the Homeless Coalition a few years back, really closely as chair, and it's amazing to watch them work, and they keep their sole focus is on making sure that we have services and we can respond to that need as it grows, but hopefully we can prevent its growth and as we keep working together.
Going back to the Affordable Care Act, if someone feels that they would qualify for that program, how would they contact you to get help with that?
Well, the best place to start, of course, is to go to healthcare.gov and see if they can navigate it. I just helped some family members over the holidays do that, and they've made it really user-friendly. Now, we know that folks sometimes haven't used a computer in years or never have, and so that's when we want them to call Community Action. If they need an appointment to talk about health insurance, they need to request that. Our appointments are filling up fast. We've got a few people who can do, we have navigators and certified application counselors, and those are folks who have gone through comprehensive training to provide that one-on-one assistance. So we have some evening appointments available, some Saturday appointments, and then of course the Lincoln Lancaster County Health Department also has a number of folks who are certified to assist. But no matter what, ask the questions and seek assistance now. We know the deadlines are coming up quickly, and so January 15th, if someone wants February 1st coverage, they have to enroll on the marketplace by January 15th. The absolute deadline this year is February 15th, and then your coverage would begin March 1st. So it's really important right now. If folks have been wondering, have been lingering, they need to make the call now or get on that website at a local library, at Community Action, and other agencies to make sure they can check out their options and hopefully find a great option for them for health coverage.
So you have a physical location. Can you tell us where you're located, or do you have more than one?
Yep. We have, of course, our main offices are at 210 O Street, so just on the west side of Harris Overpass is where we've been for, I think about, I want to say 12 years, I think. Probably actually longer than that. Either way, that's our current location. Then, of course, we have staff over at the Educare of Lincoln facility next to Belmont School, the new wing of Belmont that's connected to their new kindergarten wing. The Gathering Place at 14th and East Streets. And then, of course, within Lincoln Public Schools, we have Head Start children there. So we consider them some of our locations because we visit there, our kids are there. But then also in Wahoo Public Schools, we have classrooms that are Head Start classrooms. So even though those are public school spaces, we inhabit those with our Head Start kids, and of course our staff are in there as well. So.
Well, it sounds like a wonderful organization, and I'm glad that you're here to tell us about it. Is there anything else you'd like to add? Do you have a website that people could visit and learn more about the services that you provide?
Sure, www.communityactionatwork.org
communityactionatwork.org.
Yep, and you can go there. It's really important now. It's tax season, so volunteer income tax assistance is really important for some of our families. You can get a schedule on the front page of the website. And then also, we just encourage the community, learn more about us, invite us to speak. We love having volunteers. We love, of course, having donors, but we really want people to just connect with what we do. And if they learn more about us, I think they'll find ways to partner with us even more.
That kind of makes me think that maybe, do you have some type of a speakers bureau or something? Do you participate in going around and presenting the services to organizations?
We'll meet most any requests. We're already out in the community along with the United Way campaign, and as we get invited, we just had a volunteer income tax assistance press conference. But anytime anyone wants to learn about the agency, it's a quick call or it's a visit to us, and we'll make sure we line someone up to come talk about what we do and this really the success our families have working with us.
Well, our time is just about up, Aaron. I thank you very much for coming and speaking with us today. That wraps up this edition of The Watchful Citizen. I'm your host, Jane Egan.